Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Our presenter today is Dr. Barbara Kostick. Dr. Kostick completed her undergraduate work at Arizona State University. She graduated from medical school at the University of Colorado School of Medicine. Then she did her internship and residency at Hennepin County General Hospital. Dr. Kostick was the first woman elected president of the Washington Medical Staff in 1988. In 2000, she was elected president of the California Academy of Family Physicians. Dr. Kostick is board certified in family medicine and a fellow of the American Academy of Family Physicians. She serves on the National Task Force and commissions on many public health issues. She currently teaches medical students from the University of California School of Medicine. Dr. Kostick is the medical director of community health services at Washington Hospital. And you can see Dr. Kostick hosting Voices in Health and Your Concerns in Health on Washington Hospital's InHealth Channel 78.
Good. So, good afternoon. The reason I want to know if you are taking vitamins and what ones you're taking is that Americans spend $11.8 billion a year on vitamin and mineral supplements. So I'd like to see how much you guys spend. So that's just on the vitamins and minerals. But look at this figure. $28 million is a total sale of dietary supplements. That's more than vitamins and minerals. But that's a lot of money. And I think now that we should really figure out how we're spending our money. Is it wise to spend it that way, or can we spend it in a better way? And so that's what this talk is about. So let's just start talking and getting to know some of the definitions that we use. I think it's really important that people understand that there's a difference in what a medical person means by a definition of something, by what advertising means, by what the government means, and by what the consumer means. So, vitamins. The word was coined meaning vital amines, essential for life. Because a vitamin is a substance that is required in the diet to prevent a deficiency. In 1912, I love this guy, biochemist Casimir Funk thought that they were amines. And so he's the one that coined the phrase vital amines. There are 13 total vitamins. The last one was B12, which was discovered in 1948. They divide vitamins into two classes, the water-soluble and fat-soluble. The water-soluble are all the B vitamins and vitamin C. The fat-soluble are 4 vitamins, A, D, E, and K, ADEC. And there's a difference in understanding about fat and water-soluble, and as we go through them, you'll find out why it's important to know what kind of vitamin you're taking. So they regulate chemical reactions by which the body converts food into energy and grows living tissue. That's what vitamins do. The government measures vitamins, it used to be as a recommended dietary allowance, an RDA. And that's what you used to see on vitamin labels all the time, the RDA. But they've changed that. They've changed it now to call it a daily value, or DV, because they're not too sure on their recommendations anymore. So, change the word. The daily amount that a population needs to consume orally to prevent a deficiency. That is the daily value. And this value is set 2 standard deviations above the estimated average requirement. So here's average, where most of us fall. To make sure they don't miss anybody, they go, say, 2% above. Don't miss any from down below, they go 2% below. And that captures about 98% of the average healthy population. Remember, we're talking about healthy people. But it's not sufficient maybe for special populations. And what would we define as a special population? Well, we would define the elderly as a special population because as they age, different processes don't work as well as they did when they were younger. We define alcoholism. Alcoholics have several nutritional deficiencies. Malabsorption syndrome from a lot of different reasons like gastric bypass surgery or ulcerative colitis, regional enteritis, Crohn's, irritable bowel, celiac disease. All of these cause a problem with absorbing vitamins. And then there's also the inborn errors of metabolism. What that means is that a child is born and is born without the right enzyme to make the reaction to change one substance into another. And kidney disease also has associated with nutrient deficiencies too because of the dialysis and not being able to filter the urine themselves. They have a lot of dietary restrictions. So can we measure our vitamin levels? What do you think? Yeah. Maybe. Yes, but. What does the measurement mean when we do measure them? We don't know on some of them because normal values are uncertain in a lot of the vitamins and a very wide range. So if you have a range between 4 and 400, what's really normal? That would put just about everybody normal, including people that might really need more of the vitamin. And it would put people in that maybe are getting too much of it. And thus we can only really recognize the guys that fall out in the very, very high ranges or the very low ranges. The middle ground is still very difficult to determine. So serum levels, well, they can also be related, what you measure in the blood, to a biochemical abnormality. In that, when you measure someone's vitamin level, and it comes out normal, it could still be wrong because other systems in the blood are interfering with that level, such as homocysteine will go up when you have low folic acid. And methylmalonic acid rises with low intake of B12, and parathyroid hormone rises with low vitamin D. So let's talk about the multivitamin mineral supplements, which are called MVM. They were first introduced in the early 1940s. Those were the synthetic ones. Before that, in the 1930s, a company well known around here called Shaklee made vitamins out of natural foods, processed and dried them and compressed them into pills. Currently, they've been marketed with all the big health gurus as an insurance policy to stay healthy and prevent chronic disease, right? Take your vitamin. Your mom said, take your vitamin. Then you didn't have to worry about your diet. You didn't have to worry about a lot of other things because you took your insurance policy. So what is a supplement? It contains 3 or more vitamins and minerals, but the multivitamin supplement has no hormones, no drugs, and no herbs in it, as opposed to dietary supplements, which we'll define later. So who uses vitamins? Well, a big study was done over the phone, and what they determined in this analysis of over 1,000 people, about 1/3 of all adults use vitamins. So how many of you here take vitamins? More than 1/3. And they found that women take vitamins more than men, and that children of women who take vitamins tend to be higher vitamin users too. Elderly take vitamins. People with more education and higher income tend to take vitamins. The Western U.S. takes more vitamins than the Eastern U.S. And it seems like people with healthier lifestyles, with diet, and a lower BMI, in other words, less chance for obesity, also are higher users of multivitamins. Sounds like a good group to be in. So, who does not use multivitamins? It looks to me like it's the people who are at highest risk for nutritional deficiencies and who really might benefit the most by taking a multivitamin. they are the least likely to take them. So, do you think you need a multivitamin? You do, huh? Are you in a special population like we talked about that might need extra vitamins? Renal disease, elderly, chronic disease. Do you eat a good diet? Do you eat 5 or more servings of vegetables and fruits a day? If you eat 5 or more servings of vegetables and fruits a day, then you usually get all your dietary supplements that way. New randomized trials have made the recommendations for taking multivitamins a lot more complex because we don't determine what goes into the multivitamin. We don't determine the amount. It's already preset, packaged, and marketed to you as this is the best vitamin for you. But we found out in 2011 that vitamin use really needs to be tailored to the individual person, not just a multivite off the shelf. So, taking a multivitamin in most healthy people is not needed, and it could be harmful. But let's explore which vitamins and supplements we may be deficient on or we might need so that we can individually tailor what we need for vitamins. Instead of a bottle of multivites, we might have our own individual vitamins. And that can be based on your health, your diet, your age, your sex, what part of life you're in. And let's talk about the specific vitamins and the research. We talked about that there's 2 kinds of vitamins. There's the water-soluble ones and the fat-soluble ones. And if you look at the water-soluble ones, there's a few missing of these B things. You notice that? I always wondered. Like folate, I did not know was B9 until I looked it up for this talk. Biotin, I had to look in 3 different places to find out it was B7. Pantothenic acid, B5, didn't know that. The question is, what happened to B4? What happened to B10 and 11? Are you curious? Well, what happened is they found this big compound called vitamin B. And then they started, with more sophisticated measures, taking it apart. And when they took it apart, they found out that it was made of a bunch of different components, not just one big vitamin B. And so now we have the vitamin part of it, which is the B complex. So vitamin B, 1, 2, 3, 4, these vitamins here form the B complex. The rest of them were not vitamins, and we'll go over what they turned out to be because I was curious. And then we have our fat-soluble vitamins, the vitamin A, which is retinol, and it's also beta-carotene because beta-carotene is a vegetable form of retinol. And then it has the vitamin D for bones and vitamin E, which we're going to spend a lot of time on, and then the vitamin K. So let's first talk about the water-soluble, the B complex and C. Well, let's talk B1, thiamine. Thiamine was named the anti-beriberi factor in 1926. Now remember, to be a vitamin, you have to cause, if you don't get it, you get a deficiency. Well, the deficiency you get if you do not get thiamine is beriberi. Does anyone know what beriberi is? I thought it was a cool name. There is an early description of the disease way back in Chinese medical texts, way back in 2690 BC. It's been known that long. And what beriberi means is I cannot, in Sinhalese. Do you know what language Sinhalese is? Oh, good person. I had to Google it, but yes, it's from Sri Lanka. So how did the Chinese get to Sri Lanka? It turned out they did, and they've had pottery there and things like that, and they found the beriberi. And what happens is the victim becomes stiffer and stiffer, like arthritis, and then they actually get so stiff they get paralyzed and can't move. In their lower limbs, they get severe pain, they get anemia, they get heart failure. So it's not a very pleasant way to die. And what they found the reason was they were not getting vitamin B1 because their diet consisted mostly of polished rice. And when the rice is polished, the thiamine is removed. So the brown part of the rice contains the thiamine. So you know what our next step is what are we going to say? How are you going to get your thiamine? Eat brown rice. That's right. Yes. So, thiamin's a kind of a complicated vitamin. It has two different molecules, the pyrimidine and the thiazole. And I think it was named thiamine because of the thiazole, thioamine. But I couldn't find any documentation to prove that. And these are both actively and passively in the small intestine transported to the liver. Now, the difference between active transport and passive transport means there is no energy required for it to go. It's kind of like having a screen, and you've got a salty water on one side and fresh water on the other, and passively the salt goes over till it's equal on both sides. That's passive transport. Active transport is where you have to have something to go over, pick it up, and bring it to the other side, and that requires energy. So we call that active transport. But so then thiamine passively, just like goes through a screen, enters the red blood cell. But any other cells, it has to be actively transport to get into the cell. So for some reason, it can get into red cells, but can't get into any other ones. And you know that red cells, just parenthetically, they don't have any nuclei anymore when they're pushed out of the bone marrow. That's why they only last a certain amount of time, and we have to keep replenishing them. So the half-life of thiamine is only 10 to 20 days. It's water soluble. It breaks down. It's excreted by the kidneys. So that's why it has to be replenished on a regular basis. Some of the other vitamins you're going to find out about later have a little different ideas. So beriberi is the deficiency causing heart failure, causing the neuropathy, and, so people can't move. It also causes a syndrome in alcoholics of Wernicke-Korsakoff, where people get nystagmus. That means their eyes start jerking, and then they can't move. They just sit there and jerk, but they can't move them around. They get ataxia. They get confused. They get actually psychosis, and they confabulate. So when you go up to someone who is an alcoholic and first they tell you they're seeing the elephants, they'll see the visions. But the other thing is you can start a story with them, and they'll just take the story and just keep talking about it. And they'll make up wonderful stories to listen to. They'll just confabulate them. They usually aren't true. You'll say, well, what did you have for dinner last night? Oh, I had this wonderful turkey dinner. Oh, what did you eat? Oh, I had the breast meat and I had gravy over. He didn't, but it's just big confabulation. It's what comes out of his brain. They have a lot of memory loss. And then there's also this one syndrome there's only 100 cases so far of what's called necrotizing encephalomyopathy. That means that the brain and the muscles are eaten away because of no thiamine. So the DV, based on caloric intake, is about 0.5 milligram per 1,000 calories. Average diet is 2,000 calories, so it's about 1 milligram a day is what you need. And what is a good source of thiamine? Where as we said, the yeast, the legumes, the rice, the cereals. But the poor source, it's kind of interesting too, are milk, fruits, and vegetables. This is going to be one of the few vitamins that you don't have to eat your green vegetables. And also, thiamine is removed with baking, cooking, canning, any way that you destroy the food. This is a little better way. I got this from the USDA National Nutrient Database about different vitamins. Good place to go look on it. Tells you how much of the different vitamins are in different foods. You get the yeast extract is a big one. Have you ever tried that melamite? Oh, it tastes horrible. It's something that the Brits and the Aussies use on their bread, and it has it's made out of yeast extract, so it's supposed to be very healthy for you. The thing I really liked about this was all the seeds, the sesame seeds, sunflower seeds, pine nuts, pistachios, and in some places they put down the herbs and spices. So look at that. You can even eat poppy seeds, sage, paprika, and get your thiamine that way. Now you'd have to eat quite a bit of it. But at least put a sprinkle of herbs and spices in your food. It's good for you. It makes it taste better. So next, let's go to the next water soluble, which is vitamin B2 or riboflavin. Now this was defined in the early 1900s, but they never could isolate the structure of it until 1935. And riboflavin is the yellow pigment that you see in certain vegetables, such as yellow peppers, carrots, yellow sugar beets, sweet potatoes. And it's usually, when you eat it, it is connected to a dinucleotide. And so when you eat it, that has to be broken off in the intestine. And it is broken off by bacteria in your intestine. That's what breaks it apart so that you can absorb it. So this is one of the instances where the bacteria in the GI tract is very important for you to get your vitamins. And so people who have chronic diarrhea or who have irritable bowel, don't get enough transit time, they can't actually absorb all the vitamins they need. And then it's passively absorbed, so it's like that screen. It just filters across after it's broken down. And it arrives in the liver, and the liver cells then change it to the human FAD and FMN. And here's a little structure of it. There's no quiz, so you don't have to memorize it. I just thought it was kind of cute. I just remember doing these as a kid. And this is here's the carbon ring. See the gray? And the blue is a little nitrogen. The red's the oxygen, and the light blue are the hydrogen ions. So what does riboflavin do? It oxidizes and hydrogenates carbon chains. What that means is it takes a long chain of carbons like you get in a starch or in a sterol, and it puts OH groups on it and hydrogen groups on it and turns it into something that the body can use for energy later. And in certain populations that are at risk for this deficiency, that would be the anorexics that don't eat. It would be the malabsorption like we talked about. And then also in some people's families, there's this inborn error where they've lost the enzyme to use the riboflavin. Now, unfortunately, we cannot measure riboflavin values. We can measure them, but they don't mean anything because all they reflect is what you had just then. They don't tell you if it's too high or too low. So, and then deficiency syndromes are nonspecific too. You get swelling of the mucous membranes, you can have the burny tongue, you can get canker sores in your mouth, and toxicity is rare. So because this molecule doesn't dissolve in water very well, it's not quickly passively absorbed. So you usually can't get too much. So if you think you need to take vitamins, this would be one that would be a safe one to take. And the daily value is 1.2 milligrams a day. And what kind of foods could you get it in? It looks similar. I like the cheeses, the Roquefort Brie and Brie. I wouldn't mind getting mine that way. I like the sesame seeds. I love it that you get it in sun-dried tomatoes even more so than you get it in fresh tomatoes. And then the herbs you can use, the ancho chilies are the ones that are the highest dose of riboflavin. Must be the red color in them. And then spearmint too. So let's go on to the next one, vitamin B3, niacin. Okay, now I think most of you are familiar with niacin, right? You probably know what the big side effect is of niacin too. Okay, so why do we take niacin? Because if we don't take it, we get raw pellagra, dry skin. That was first mentioned by the Spanish physician Kostick back in the 1735. But he thought that all this dry, rotting skin was an infectious disease. He didn't recognize that it was a vitamin deficiency. So it was isolated in 1867, and they called it the anti-pellagra factor in 1937. This was remember when they were starting to develop the vitamins. So pellagra was also very endemic in the corn-eating southeast U.S., and it's still a problem down there. It seems like there is no niacin in corn. Very, very low. So if you use that as your staple instead of some of the other foods like whole wheat or brown rice, then you don't get the niacin. And niacin has an interesting pathway too in that, here, oh, I misspelled dietary, don't look at that. The dietary niacin goes in, again, in the form of NAD because it's usually in a meat and that's how the meat stores their niacin. In the intestine, it's cleaved down to nicotinamide. The intestinal bacteria then change it to nicotinic acid, make it water soluble so it can get into the bloodstream, and then it goes to the liver, kidney, and red cell. So, and in those areas, it's changed back to NAD. Seems like an inefficient process, doesn't it? Start at NAD, go through all these little steps, then back to NAD. But NAD is the enzyme that helps you make energy. And so the niacin works in the workhorse part of the cell, the mitochondria. This is where what's called cellular respiration takes place. This is where we do energy for the cell. And with tryptophan, they form these coenzymes, which helps us, which gives energy to break down different molecules. The daily value, though, look how low it is. 15 to 20 units is all it is. That's all you need. Now, does niacin have any medical benefit outside of not causing pellagra? Yeah, it does. And this is probably where you've heard of it before, because high doses of niacin tend to lower the bad kind of cholesterol, the LDL. Do you guys remember how to remember the good kind of cholesterol from the bad kind of cholesterol? Yeah, my daughter taught me. She says HDL is the good kind. She says H stands for happy. So now I remember it. It also stands for high-density lipoprotein. And the way I look at cholesterol is the low-density lipoprotein are like little dust balls that are floating around your bloodstream, ready to go stick on any of those little arteries, forming plaques. And the high-density ones are big, heavy balls, like a little vacuum cleaner going in and sucking them up. So let's talk about the one good study that did show that when you combine niacin with this particular substance, cholesterol, which is not a statin, it binds with the bile acids, so it prevents cholesterol from being absorbed. Then you do reduce the progression of the atherosclerotic changes, and it was pretty impressive, 52% versus 15% without it. The problem with niacin is that it can be uncomfortable to take because it causes a lot of flushing. You know, the big red flush. And what we tell our patients is to start low, take an aspirin about half an hour before because that will block the flushing, and to gradually build it up to about 2 grams a day. But you could also get niacin from food sources. You can get it from that brown rice. You can get it from anchovies. You can get your omega-3s that way too. And if you wanted to use liver, lamb liver is the highest in niacin. But you can use your paprika. You can eat your handful of peanuts, veal. I love the bacon. I almost took it off, but I thought, oh, let's be honest, leave it on. But there's a problem with niacin too, in that you can have a niacin toxicity. Because at moderate to high doses, and that's 1,000 milligrams to 3,000 milligrams. And remember, I said you can take 2,000 to lower your cholesterol, so it's right in there. You can get nausea and vomiting, itching, hives, rash. I just saw a patient in my office yesterday that had a niacin rash. Had been taking it for years, but all of a sudden, that person had a rash from it. And it can elevate your liver enzymes, not live enzymes. And it can also raise your uric acid so that you can get gout. I think over 2,000 is too much. Yeah, I think you should stick at 2,000. And you should be monitored if you're at that dose too, to make sure it's not affecting your liver. Because it's severely toxic to the liver at 2 to 6 grams, and especially in the long-acting forms, because remember, it stays around a long time. The other thing is, putting on my other hat, I've been on this task force for medication errors in children, and this is one of the most dangerous things you can leave around that a child might pick up too, because it can literally kill their liver in a very, very small dose. So be very careful with your vitamins and supplements that they don't get available to your grandchildren or children who are around. So let's talk about vitamin B4. I use this little picture of the king crane because it's not really a king and this is not really a vitamin. It's actually adenine, which is one of the 4 amino acids that make up the DNA chain. And I just remember from high school, remember adenine to thymine, guanine to cytosine, and they make the little ladder together. No one else has that memory? Yeah. Okay, vitamin B5. Pantothenic acid. I had to look several places to find out that that was actually vitamin B5, because they always call it pantothenic acid. And the reason for that, there's a lot of different forms of the pantothenic acid. So if you had to put in all the different things for vitamin B5, it would be like 6 different forms and list them all. It was first synthesized back in the 1940s, remember when they were making the vitamins. And this is an active form of coenzyme A, CoA we call it, which is used in, that was my favorite enzyme in biochemistry. We use it in just a plethora of reactions. And you'll have a big chain coming in, and you just put CoA right up over the arrow, and it goes to the other side, and it makes a nice little protein or a nice little cholesterol. Or it's a wonderful little enzyme. So it's the essential cofactor because it acetylates. It adds this COOH group to things, making things more water soluble. And so it can either add or remove this from fatty acids, steroids, proteins, and it's basically the acetyl group is basically vinegar. Vinegar is acetic acid. And if there's any scientists in here that, correct me if I'm not saying it right. So pantothenic acid metabolism, it's similar to the niacin. Remember, these are all water soluble. So if you remember that, when we get to the fat soluble, you'll see they're absorbed a little differently because they're fat soluble. But the water soluble, first they have to be broken down, then they have to pass through the membrane, and then by bloodstream they get to the liver, and then they're built up again. And they just, they add water to the pantothenic acid in the small intestine. The jejunum is part of the small intestine. It's the upper part, ileum's the lower part. And then it is, when you use a sodium pump into the bloodstream, that means that it has to be transported. So that means it requires energy to get this into the body. Remember, passive transport doesn't require energy. And then it has to be actively transported into the cells too. So it's an expensive little bugger to pick up. And here's what it looks like. You can see all the nice big red and the blue, and then there's a little carbon hiding underneath because it's really just a carbon chain. Before you saw the little hexagonal rings on the other hormones. This is just a carbon chain. So very water soluble. Probably has to add a lot of fat to it to get it anywhere else. They can't measure it. They can do it in a scientific lab, with lots of help. But for us to go down and say, would you measure my pantothenic acid level, they just laugh at us. It has no known toxicity because it's water soluble, and the excess is excreted out the kidneys. One of the big things that they tout is that pantothenic acid may help with acne. So for teenagers, you might want to look at their vitamins if you're giving to them and make sure they're getting enough of it. Or you could feed them liver. I don't think they'd eat it. Maybe sunflower seeds. And I love that it's the shiitake mushroom. I think I'm going to get mine through shiitake mushrooms, the caviar, and the Jitos cheese. Well, let's see. It's very difficult to tell if there's a deficiency. They show a lot of problems if they're really deficient in animal models. They don't grow, they hemorrhage, they have necrosis of the adrenal gland, they even get gray hair. But in severely malnourished humans, the big thing they get is burning feet. And we get a lot of diabetics with burning feet, so I think I'm going to go check and see how much pantothenic acid they have in their diet. Maybe I can help them. And they also get GI distress. So there's your little cub. Remember to think about him, and then he might need his pantothenic acid. Now, B6, pyridoxine. B6 is an interesting vitamin because it can be overdosed also, just like niacin, so you want to be careful with it. Actually, they found it when they found the anti-pellagra factor, but then they separated it out. And several forms as usual. You can see there's plant-derived ones as well as animal-derived ones, which is really good because that means that vegetarians can certainly get their B6 without having to eat meat. The active form is the animal form. And what B6 does is it removes the amines, which are the nitrogen, from proteins, turning them into long chains of carbon chains, turning them into cholesterol or sterols or even glucose. And it converts tryptophan to niacin. And it's involved in the steroid hormone modulation too. So you said it can make more steroid hormone if you don't have enough. So adults need about 2 milligrams a day. Deficiency is really very rare. But the low levels can cause that burning tongue. It can cause cracked lips, irritability, confusion, depression, and not just while watching a football game. And then there are genetic syndromes also. You know, remember, if you've lacked the enzyme, you can be vitamin B6 deficient also. So we can measure it. It's 26 to 95 nanomoles per liter. That's a big range. What if you have burning feet and your level came back 28? Does that mean you really need more? Or are you normal and you have burning feet from something else?
Is that something about making glucose?
Yes.
So if you're diabetic, that's another?
No, it's much better. The diabetics get in trouble because they take too many simple sugars. They need to slow down their sugars that they eat. If they can take complex sugars that need to be broken down first, then their sugar stays much better controlled because they're using energy to break it down. That's why even fructose raises your sugar more than glucose, because fructose is even easier to convert into, you know, just the sugar molecule. Yeah. So that's why you also want fiber, remember? Because fiber also helps you so that you don't absorb as much of these chemicals so that your sugar doesn't go up so fast. And then, of course, it has all these sophisticated ways to look at it, too. And there it is. I thought that was kind of a cute molecule. See, it's got the little carbon ring with the nitrogen on it, and then it's got the chains of here's the methyl group, and the OH, the hydroxylate group. Now, the only problem with B6 is you can have too much of it. And when you have too much B6, you get a peripheral neuropathy. Peripheral neuropathy. You get rashes, photosensitivity, dizziness, and nausea. So a lot of people, when we put someone on anti-tubercular medicines, INH, we have to give them B6. But we always tell them that if they start getting any numbness or tingling in their arms or their toes, to please stop taking the B6. You don't need any more. You have it enough in your diet. And then here's all the places you can get it. I love the raw garlic. I love that, you know, turkey liver. Look at that. What are you going to have for Thanksgiving? You know, get that giblet gravy. Molasses. Yeah. You know, figure out a meal tonight. B7 biotin. Oh, this is a messy one because it got characterized as a vitamin, and a lot of people are still arguing on, is it really a vitamin or not? I mean, maybe we only have 12 vitamins. But it functions as a cofactor, so they say it could be. It was discovered by Dr. Bateman in 1916, and he called it vitamin H for hair and skin, and he was a German, Haar und Haut. And so you might hear it in you know, the ads for vitamins. They might say, oh, and you need your vitamin H, but we also have biotin in it too. Yeah, it's the same thing. And it's separated into another growth factors in the yeast, which is how they found it, and that's why they called it biotin for the bios. And the reason I put this little guy up here is he is a bacteria, because the only active form of biotin is the D isomer, called biocidin. And when it's bound to lysine, it's active. These synthetic analogs that people make, you know, when you make an analog of something, you make half the right-sided, the dextro form, half the left-sided. And if you get vitamins over the counter like that, that aren't just D isomer, the other isomers actually block your being able to use that vitamin. We're very specific in what we need. We really need things that fit just our lock. And so you have to read the label and make sure that you are getting the D isomer of biotin if you think you need it. And then the bacteria in our GI tract make the biotin for us when they break down the proteins. And again, if you're taking a lot of antibiotics, if you have inflammatory bowel disease, you know, there's a good chance you don't have this bacteria. So you aren't getting enough of this, you know, of this vitamin. I like probiotics for that too. The excess biotin, though, that it absorbs it just gets excreted out the kidney since it's water soluble. So you can't get in trouble with it. Oh, that's. So who needs it? Well, people on long-term parenteral nutrition. You know, they don't have a GI tract. They don't have the way of breaking down the biotin. People are usually on antibiotics if they're getting, if they're getting their nutrients that way. And then there are some congenital disorders. And how much do we need? There's no real accurate data saying how much we really need. So biotin food choices, you get your brewer's yeast, your cooked eggs, the egg yolks, sardines. It's interesting that raw egg whites can actually block the biotin. So if people like to eat a lot of steak tartare with their raw egg, they might not be getting all the biotin they could. And it can be easily be destroyed by processed versions of it, like overcooking it. So B8, vitamin B8 is not a vitamin. It's found to be adenosine monophosphate, and the body can make this. Just like these are my 2 little grandkids and my husband. And I use that slide because the next slide is the pregnancy vitamin, vitamin B9, folic acid. Lack of it can cause the megaloblastic anemia. That means that the cells are bigger than normal. When you measure the cells, they come out as bigger than the normal hemoglobin cell. And it can cause the birth defects of spina bifida, because if you don't have enough B9, then the tube doesn't close, the neural tube doesn't close embryologically. So when the embryo is formed, the cells form kind of like you're making bread. They form a little ridge in the middle, and then it folds together, and it kind of zips closed. You need folate to zip close. If you don't have the folate, some of the teeth might be missing in that zipper, and that's where you get the neurotube defect. And in many observational studies, they found that people who had low folic acid did have a higher incidence of babies with neural tube defects. That's how it was figured out. And they did this study. Look at how long ago they did this study. 1817. They did a very good study. They took women who had already had a child with a spinal defect, and they divided them up into 4 groups. One group got folate. The other group got every other vitamin except folate. The third group got folate and the other vitamins, and the fourth group didn't get any. And what did they find? They found, well, almost 1,200 completed the study, and they found that 27 kids in that group did get neural tube defects. In the A and C groups that got folic acid, both got supplemented with folate, only 6 children had neurotube defects. In the B and D, the ones that got regular vitamins and the ones that got nothing, 21 children got neurotube defects. So I think this is a really good study. I don't think it should be repeated, but I think it's a really, really good study. And so they think that the other thing they found out is that the defect in the neural tube occurs very, very early in the pregnancy. It occurs on days 15 to 28. So that means that's not 15 to 28 days after your period or when you should have had your period. That's when you have sex and conceive. It can occur 2 weeks after that. You might not even know you're pregnant. Back then, without the special test, they probably didn't. So in 1998, the FDA mandated cereal grains to be fortified with folic acid. And this is what the government has decided to do about certain necessary vitamins. They try to fortify the foods. They think that's easier than having everyone buy multivitamins. So the recommendation is that women in their childbearing years should take a vitamin supplement of at least 400 micrograms of folate. And if they are pregnant or trying to conceive, they need to take 800. Now, after you have your babies, you're not going to get pregnant anymore, you're not childbearing age, you really don't need to take a folate supplement. But maybe folic acid would decrease cardiovascular disease. The theory was that with high levels of homocysteine, you get an increased risk of cardiovascular disease. And folate, along with the B6 and B12, lowers the homocysteine levels. So maybe if you took all of those, you would have less heart disease, right? A lot of cardiologists were doing this 10 years ago. Yeah, they had their folic acid, 10 milligrams a day, whatever. But it turned out it didn't work. And they found that in secondary prevention, there was no benefit. Secondary prevention means that the person had the event and they're trying to prevent a secondary one. In primary prevention means the person didn't have the event and they just want to prevent it. And so there was no data in primary. Nothing happened. So in other words, they don't really think it works. Well, how about preventing cancer? You think folic acid could prevent cancer? It plays a key role in cell regeneration, and it could protect the DNA against damage. That's the thought. But the data was very inconsistent. And so they found that it may lower the risk of colon cancer in a moderate alcohol drinker. And it may lower the risk of breast cancer in a woman with moderate alcohol intake. But other than that, it didn't have much effect. So to get your folate, again, that turkey liver and the sunflower seeds. I love the dry roasted soybeans, you know, and then of course the dark leafy vegetables are in there too. And I love the dry herbs, but it says like spearmint is the highest at 3% per tablespoon is what you would get, 3% of your daily allotment if you just had spearmint. So you'd have to take how many tablespoons of spearmint if you didn't eat anything else? Quite a few, 90 or something. Anyway, so any other benefit of folate? Well, people thought maybe hypertension, but they can't find anything. It was observational data. Observational data forms an association. It means I look at something and it seems to be associated with something, but it is not proof. It doesn't prove cause and effect. It just discusses that there's an association. Hearing loss, they think it might help, but no one can find out why. And they didn't know if folate would help with the elevated homocysteine levels associated with dementia and osteoporosis. Probably not, because it didn't help with anything else. Then, if you take too much folate, what happens? Well, you might increase your risk of cancer in some studies. So people who take too much folate have an increased risk of some cancers. Yeah, it can mask a vitamin B12 deficiency, and it could precipitate the neurologic damage of not having the vitamin B12. Yeah, I would say, I frankly would not supplement someone if they're not of childbearing age. There's no reason to take it. And it was interesting, if they took folate in the later part of the pregnancy at that increased dose, they did have a higher incidence of the child being asthmatic. So B10 and B11, but both are not vitamins. B10 is the para-aminobenzoic acid, or PABA. You remember what that's used in? Sunscreens, right. That's right. Which these boys should be wearing every day they're out in the pool. So B12, last B vitamin. It was the last vitamin found in 1948, and it is the most complex. And it was discovered by curing pernicious anemia. What happened, one of the early scientists would eat his food, and then he would regurgitate his food and give that to people who have pernicious anemia, and they would improve. Yeah. He didn't get the Nobel Prize. A few of the other ones did. The levels can be measured in the blood, and the deficiency in the elderly, we think, this is one of the places where you really want to check the B12 level, because anyone who you think has dementia or memory loss really needs to make sure they have adequate B12. So this is pro. I'm pro this vitamin. And remember, when I started practice, little old people would come in every month for their B12 injection, you know, that $8 shot, make them feel better, perk them up. But the oral dose is just as effective as the shot now. And the oral dose is just as effective as the nasal spray one, too. And if you look at the price, it's about, what, 1/10 the cost. So this is why it's so complicated. If you look at it, there's a cobalt molecule right in the middle of it. And I couldn't even get a picture of all the, of all the big bubbles. They had to make them into sticks instead. So what causes B12 deficiency? Well, in pernicious anemia, the person is unable to make this certain substance in their stomach called intrinsic factor. And because they can't make the intrinsic factor, the B12 cannot be absorbed in the intestine and get into the body. So that's why you have deficiency in B12. If you have Crohn's disease, you might have intrinsic factor, but you can't absorb it through your intestine because it's all inflamed. So they could be low in B12 also. Abnormal bacteria growth in the stomach, because that interferes with the regular good kind of bacteria that you have. And it's kind of like, when you put those hyacinths in a pond and they take over the whole pond and you can't have any other plant there. And then certain medicines that treat heartburn and ulcers that lower stomach acid, and I'm sure we could all name at least 5 or 6 of them. Those also put you at risk for B12 deficiency, because if you lower your stomach acid, you don't make enough intrinsic factor. So think about that. Think about your heartburn. See if you can figure out physiologic ways on how to control it, weight loss and sleeping with your pillow up, instead of just taking a PPI or 3 PPIs. And then there's the GI surgery, like the gastric bypass or removing part of the intestine for a cancer. All of those will also give you a B12 deficiency. So how are we going to get our B12? Boy, I love this. I love oysters, even though I spelled it osters. And caviar, octopus, crab, lobster, Swiss cheese, love that. And I noticed that if you like eggs, the goose has the highest level of B12. Of B12 a day, 1 milligram. Is all. Yeah, it's not very much. Scurvy. This is a picture of a Greek statue, so I put it with the Greeks. And scurvy was first described by the ancient Egyptians, Greeks, and Romans. And scurvy occurs about 3 weeks into a sea voyage. The sailors start getting tired, their gums start bleeding. As they continue on in the voyage, their teeth fall out. James Lynn, he was actually a Scotsman, British naval surgeon, did the first clinical trial to discover how he could heal someone with scurvy. And while he was at sea, he divided his seamen into different classes. And he had some seamen, the control, do nothing unusual. He had other seamen take vinegar, because he thought it might be bacteria that caused it. And then he had other seamen take lemon juice. And then he had another group that took both. And what he found out was that the group that took the lemon juice, or the lemon juice with vinegar, did not develop as severe an infection as the people that did nothing or that took vinegar. And so he wrote a beautiful article, sent it in, and it was totally ignored. So he went home to his farm in Scotland and discovered some other things. But James Cook, who went to the Hawaiian Islands and around the world, he read Lynn's article, and he decided that on his voyages he's going to make sure that he does have fresh vegetables and some fruits. And so people really wanted to travel with Cook because he would come back with healthy men. So here's vitamin C, kind of a simple looking thing. Now, vitamin C is absorbed in the small intestine actively. What does that mean? Come on, we went through this. Needs energy. You can only absorb so much. So doses up to 100 milligrams are almost totally absorbed. After that, it really falls off. So any dose over 200 milligrams is not absorbed. So how many of you take 1,000 milligram vitamin C? Don't even raise your hand. It's such a joke. Just think, you've saturated your body. All you've done is given yourself that kind of, that luminescent yellow urine and stool. And the other thing I found in patients who take a lot of huge doses of vitamin C is they actually get irritation in their rectal area too. from the vitamin C being excreted that way, the excess. So be careful. Take what you need. If you think you need more, take it at certain intervals. You know, that way the 100 milligrams can be absorbed. 4 hours later, another 100 milligrams can be absorbed. But it can't all be absorbed at once. So the blood concentration of vitamin C is really regulated by the kidneys, and that's why you get that bright yellow urine. Kidneys say there's too much vitamin C, so it excretes it. And the greatest concentrations of vitamin C, which I didn't know, were in the pituitary, adrenal, and adrenal glands, the brain, the white cells, and the eye. Yeah. So it acts as, it's again, you know, it's part of the enzyme process, and it reduces things with metals, with heavy metals like iron and copper. And if someone in fact, if someone wants to take iron pills, we advise them to take them with a little bit of vitamin C because it helps with the absorption. And you're going to be told later, if I don't forget, that remember, postmenopausal women should not be taking iron pills. They have an increased mortality. And vitamin C stabilizes vitamin E and folate. So it's a cofactor, and it works in a bunch of different things. You don't just read through it. You hear about carnitine all the time. So I just wanted to show you the carnitine molecule, which is responsible for transporting the fatty acids across cell membranes. And it's in the formation of collagen, so we all have nice, tight skin. It helps with wound healing. It helps with tooth formation. It helps with the osteoblasts. Osteoblasts are the cells that make bone. Osteoclasts are the cells that break the bone down. And it's important in the synthesis of norepinephrine. You know, that's a form of adrenaline, the neurotransmitter. And prostaglandin, which, you know, is what is secreted when someone has an inflammatory response. So it's very ubiquitous. If you don't have enough, you get bleeding gums, easy bruisability, Sjogren's syndrome. So people with Sjogren's syndrome, are they checked for vitamin C? Don't know. Arthralgias, malaise, occurs in severe malnutrition, like in drug users, you know, and all the meth users that don't have teeth. Even some seniors with poor dietary intake. And then newborns and infants might too, because they get breast milk is where they get their vitamin C, and it's not quite enough. So they have to have enough breast milk to do that. The daily dose is really only 60 milligrams. Not very much, not 1,000. Does it prevent chronic disease? Who reads Linus Pauling? Okay, thank you, Susan. Yeah, atherosclerosis. So the thought was that oxidation of the LDL cholesterol in the blood causes plaques. Vitamin C could probably reduce it, but the evidence didn't show it. They couldn't find it in any evidence. So they just recommend, the American Heart Association just recommends a diet rich in fruits and vegetables because it's good for you, not because it'll prevent cardiovascular disease. Cancer prevention. Higher cancer rate in vitamin C deficient populations, but supplementing a normal population doesn't decrease the rate. Common cold. I take vitamin C when I have a common cold. It says there's no solid evidence that it prevents a common cold. And I'm very glad because I don't like to take things every day. But if you take it when you first start out with a cold, it does shorten the duration of the cold. My trick, I like to take the chewable ones so that I just suck them in my mouth because I feel that then it gets right in the mucous membranes, right where it needs to be, right where I have my cold. There is no scientific basis for that, okay? It just makes me feel better. Vitamin C toxicity, you get gas, nausea. You can have an occasional fatal cardiac arrhythmia on big doses. Big doses meaning 2 grams, 5 grams, not 200 milligrams. And vitamin C, there's a big discussion about does it cause kidney stones? Because if anyone suffered kidney stones, I'm sure they've heard from their urologist that they should acidify their urine and take their vitamin C. Well, then they find out that taking that actually makes the kidney stone worse in some people. So now where are we? And so they found one study showed that if you took 1,500 milligrams of vitamin C, then there was less risk of kidney stone than in just taking 250. But that was observational data, and you and I know since it's not absorbed at 1,500 milligrams, this really doesn't make sense. So. More news later. The red vitamin C, I love the red and green hot chili peppers and the guavas. That sounded really good. And the kiwi, love kiwis, love papaya, strawberries. Vitamin C, that's a good vitamin. I like to eat those things. Yeah, just jot, if there's one or two foods that you really like, jot it down, then you'll know that you're getting enough of the vitamin. Okay, so what are antioxidants? I thought we'd take a little bit of time talking about what antioxidants were. The hypothesis is that antioxidants can prevent cancer and cardiovascular disease by boosting the body's ability to remove the toxic free radicals, right? That's our theory. We all think, oh yeah, that should work. And the way we came up with that theory was we had observational data. We looked around, we saw the association between diets high in vegetables and fruit, antioxidant-rich foods, and a reduced risk of cancer and cardiovascular disease. So we thought, well, we don't have to eat all this stuff. We'll just take a pill and see what happens, right? So we take antioxidant supplements, which is the A, C, and E. Those are the antioxidant supplements. And so what happened? Randomized trials with them showed that really didn't help. Did not decrease the risk of cancer or cardiovascular disease at all. They did have one, the polyp prevention study, that showed no reduction in adenoma risk in making little polyps. Even with beta-carotene, vitamin C, and E, and all of the above, they still had statistically the same amount as people who didn't take it. So it seems, I personally think what this means is it seems there's something in the foods that helps us more than just the vitamin to help us stay healthy and not get cancer. And that's why I'm becoming more and more this person that thinks I should get my vitamins in my foods, because there's other things in them that I don't know what they are yet. So what about the fat-soluble vitamins? They are definitely more toxic than the water-soluble because you cannot excrete them. And they all have a similar metabolism. It's confusing, but it's a little elegant too, in that they are fatty acids. They're fat soluble, so they're long fat things. And they're broken down in the upper intestine by the pancreatic enzyme lipase. And then they mix with the human bile to form this little package called the mycel. So the bile salts mix around them, hold them in, and then they enter the mucosal cells to make what are called chylomicrons, little bigger packages. And then instead of going into the bloodstream, they go up through the lymphatic channels up into the liver. Elegant. And there's vitamin A. See, not much oxygen in it, not much water. See, it's all carbon and hydrogens. So vitamin A is also called retinol. It was first, one of the earliest times they talked about it was in ancient Egypt, where the Egyptians found out that people developed night blindness that was cured if they ate liver. So total vitamin A, almost 50 to 85% of it is in the liver. And there's two forms of vitamin A. There's the preform retinol that is animal vitamin A. And then there's the provitamin A, which are the carotenoids, which are the vegetable and fruit vitamin A. But they all have properties. They're both antioxidants, and they also induce cell dedifferentiation, which means they make the cell live up to its potential. If it's going to be a heart cell, it becomes a heart cell. So what are their actions? Well, in vision, they prevent abnormalities in the cornea. If you don't get enough vitamin A, your cornea gets to be stippled, it overgrows in some areas, and the conjunctiva overgrows. With vitamin A, the cells are dedifferentiated so that they become just corneal cells and not some fibroblasts making scar tissue. In the rod cells in your eye, in the back of your eye, you have two kinds of cells that you see with. They are called rods and cones. And the rods are the ones that detect motion, not color. Cones are the color. And that's what you need for night vision, is you need to be able, you use night vision by seeing when something moves. Then you know it's there. And so that's what retinol does, is it binds with the membrane so that you get a reaction so that you see the movement. And then it also is associated with mucus and hair production, good hair. I always talk about vitamin A on the hair. Vitamin A on the hair doesn't do any good. Vitamin A, yeah, In the body, yes, it'll do good, but not on the hair. So what were the reasons for deficiency of vitamin A? Well, children in a developing country, it's the third most common nutritional deficiency in the world. People with fat malabsorption, like if they have cystic fibrosis or if they have cholestatic liver, small bowel Crohn's, pancreatic insufficiency, those are people who have a vitamin A deficiency. Most of us do not. Now, vitamin A and disease, cancer. Does it help with cancer? Yes or no? Mixed results. Lung cancer is increased among smokers and asbestos workers if they receive beta-carotene supplements, the vegetable vitamin A. That's kind of scary. In the Women's Health Initiative, nothing happened. In the ATBC cancer prevention study, showed an increase in prostate mortality with increased beta-carotenes. So this is another vitamin that you do not want to take in mega doses. Write it down. This is the one you don't take in mega doses. It's just like niacin, not in mega doses. Then you look at cardiovascular disease, no benefit. They can't find, doesn't either secondary or primary. Immunity, how does it affect immunity? It's only a benefit in people who are truly deficient, like in developing countries. It usually doesn't do anything for us. And then dermatologic, it does reduce the proliferation of sebaceous cells, and it decreases acne. How do we know that? Because of retin A that they use for acne, that they put on their skin, you know, to get the wrinkles, make new collagen. That's vitamin A. If you use retin A, you probably don't need any other supplementation. So there's the retina. Here's where the rod cells are in the fovea. This is the optic nerve here. So my thing is vitamin A will prevent night blindness, but too much is not beneficial. Might be even harmful. More course. Vitamin D. Vitamin D is the wonder drug, right? Isn't it? Isn't it the one that you got to take? Okay, well, vitamin D is really pretty unique too, because it might not be a vitamin. It could be a hormone. And because it functions as a chemical messenger, as well as being a catalyst. So the disease state, but it causes a disease state called rickets, found in children, with the poor bones. And it has several forms. There's a plant steroidal form, which is D2. All the vitamin D2 is plant-based. The vitamin D3 is animal-based. The humans can't use vitamin D2. It has to be converted to D3 for us to use it. It's made in your skin and stored in your skin. That's how kids get it. But as we get older, our little cells that make that, our melanocytes, don't do very well. So they don't make it as well as they used to. So you can, the sunlight converts it to D3 and it goes to the liver. Or you can get it in a vitamin, preferably the D3 form. And it goes into the liver, and there it gets a OH group. We call that hydroxylation. It gets hydroxylated. And from there, it goes into the kidney where it gets a second hydroxylation. And then it becomes the active form of vitamin D. So it's pretty cool. It needs how many organs? It needs 3 organs to become vitamin D. It needs the skin, the liver, and the kidney. We'll get there. So vitamin D deficiency, it's very common in the elderly because they have impaired availability. They don't take enough in. They can have fat malabsorption. They can have and then they can't turn the sunlight into vitamin D as they get older too. They don't stay out in the sun. We use sunscreens. They have studies that show that depending on your latitude, how vitamin D deficient you are, the higher, the farther away from the equator you are, the more vitamin D deficient. And the farther away from the equator, the more vitamin D deficient you are, the higher the rate of breast cancer. So these are all things that can interfere with vitamin D. There it is, very pretty molecule. Doesn't have much oxygen on it, see? Fat soluble, not much oxygen. Well, does it prevent chronic disease? Yeah, we know it prevents osteoporosis. There's good evidence in the reduction in fracture risk, especially if you are deficient in vitamin D. Now, what about cancer? Mixed results so far. Most think that it could help prevent breast and colon cancers. And there's a lot of data out there showing that in younger premenopausal women, it does lower their risk of breast cancer. Postmenopausal women, it helps more with osteoporosis than it does breast cancer. And we're assuming colon cancer goes along with it because breast and colon cancer usually have the same triggers for some reason. All-cause mortality, observational data that too much and too little is associated with higher mortality. Take too much, you're more likely to die. Take too little, you're more likely to die. So what is too much of a good thing? Or why is too much of a good thing? So you have the natural vitamin D3. It raises the calcium in the blood. So if you get too much vitamin D, your calcium goes too high. What happens then? Your parathyroid hormone starts kicking in, knocking it down, and you can have a cardiac arrhythmia and die. Too much vitamin D, you can get kidney stones. It can also unmask that hyperparathyroid disease. So the Institute of Medicine, here's one we know, recommends the upper limit at 4,000 milligrams daily. They say after that it's dangerous and getting kidney stones and raising your calcium in your blood, things like that. However, primitive societies, if you extrapolated back their diet and what they ate and stuff, they probably needed 6,000 to 10,000 IU a day. But we're not primitive anymore. So, what's a big source of vitamin D? Well, back in the turn of the century, what happened to all little kids before they went out in the snow? Yeah, that tablespoon of cod liver oil. That's right. And let's see, they fortified the cereal with vitamin D. They fortified milk with vitamin D. Frankly, I'd like the oysters. And then on them, the mushrooms that are higher in vitamin D are not the shiitake, but the white button ones. So, deficiency is common in the elderly. Supplements have been shown to reduce the risk of fracture. The daily value has been modified up from 400 to 800 now. Some people will say 6, but I'm pretty sure it's going to bump up to 8 within the next 2 or 3 years. And you can measure the serum vitamin D level. It's not recommended as a screening test, but it is recommended in populations who have osteoporosis or osteopenia or a risk factor for that. So you don't just go in and say, I need it, but you get evaluated for what your risk is for osteoporosis. So that fits about everybody, every female over 60. Okay, so vitamin E. This one is important, you guys. Now we're going to talk about the men. In 1922, researchers discovered a substance that was deficient in diets in a rat. See my little rat doctor down there. They fed rats lard, and they found out that they became infertile. They wouldn't make baby rats. But they corrected it, and the rats became fertile again if they used an extract of cereal, put oil and cereal together, and gave it to them. Then they got it. So they called it vitamin E, they called it the anti-sterility factor. You know, people get paid for doing this kind of research. Yeah. In 1925, vitamin E was recognized. But it took until 1969 for the FDA to recognize it. A little bit of lag time there. And tocopherol is Greek of origin. The toc means child, and the aphero means to bring forth. So that's what the anti-sterility factor, tocopherol, bring forth the child. So vitamin E, and vitamin E is kind of a mixture too. There's at least 8 biologically active vitamin E compounds. That's why it's so hard to do research. You know, maybe you're researching the wrong compound for the wrong person. You know, maybe one of the compounds works better on some people than the other, even though they're both called vitamin E. So from the liver, it's secreted into the bloodstream in little packages of the VLDL molecules. Now remember, that's one of the cholesterol forms that's the precursor of the LDL, which is the bad cholesterol. And it functions as an antioxidant. So let's talk about this oxidative modification hypothesis that you've been hearing about for the last couple of years. Remember, they have these beautiful slides showing the little endothelium, getting the plaque formation, and all put out by drug companies. the LDL through oxidative stress undergoes a cascade of changes, and it irritates the vascular endothelium, causing an inflammation. And that's what, and then the plaque is kind of like a bandage over that area of irritation. So low vitamin E has been linked to cardiac events. People who have cardiac events have low vitamin E. Observational data. But randomized trials, when you finally tried to do a good trial, they couldn't find any prevention of heart disease. And in fact, they found that in people who had heart disease, if they took a vitamin E supplement, they were at higher risk for a cardiac event. And yet, just this data came out, a couple of years ago. Just last week, I had 2 people walk into my office on vitamin E, thinking they were taking it for their heart. So what about cancer? Look at this one. Health professionals follow-up study, observational data. Remember, observational. They didn't find any association of vitamin E and prostate cancer. They found a 66% decrease in metastatic prostate cancer with those who smoke. Wow. And several other studies confirmed it. Wow, vitamin E prevented metastatic prostate cancer in men who smoked. Okay, well, that was the data about a year ago. Then, October 11th, 2011, what do you see in the paper? Vitamin E supplements increase incidence of prostate cancer. Wow, that's pretty scary. What changed? Remember, it's the difference between observation and controlled. The Journal of the American Medical Association published this article. They took a vitamin E supplement and they said it significantly increased the incidence of prostate cancer in healthy men. That's scary. And the findings, what they did, is they were from a previous group of men who had taken selenium and vitamin E in this trial called the SELECT trial. They were all healthy. They were over age 50, so not that old. And at the end of the trial, nothing had happened. So, and the trial was funded by the National Cancer Institute, so good trial, good data. But then they did a follow-up on all these groups. So the participants in this study were assigned into 4 different treatment groups. One, the standard thing, plus, minus, plus, that. One got selenium, one got vitamin E, one got both, and then one got placebo. So the 4 different groups. And the initial report stated that selenium and vitamin E together or apart did not prevent prostate cancer. So they said, okay, let's quit the study. Doesn't seem like we need it. Didn't seem to change the incidence of prostate cancer one way or the other. Now, most of these healthy guys didn't smoke. That's why you didn't see the metastatic and stuff. So the SELECT people did a follow-up 7 years after they stopped the trial. And there, they found the incidence of prostate cancer had increased by 17% in the men who had received vitamin E supplementation, compared to those who didn't take vitamin E. Now, if you took the vitamin E and selenium, you were lucky because they didn't have an increase either. But selenium has its own set of problems too, Well, that's kind of scary, isn't it? Here's a study that shows that was well run, that didn't show any incidence at the time of the conclusion of the study, and yet 7 years later, now they are finding out things. And that's how it is in our science world. Just wait around and we'll have a new study for you that'll tell you something else. So they thought, well, maybe there's a biological explanation about vitamin E. And they suggested that, things, especially the fat-soluble vitamins, stick around a lot longer than people think. Now, vitamin E isn't dead. People are still trying to think, is it with dementia? Observational shows it might help. Does it help with infection? Remember, we were supposed to put vitamin E on all our infections. That doesn't work. And there is an increase in all-cause mortality with high-dose vitamin E. So if you think you need to take vitamin E, no more than 400 IU. And I don't think you need to take it. But you can take your almonds, you can take your pine nuts, you can have peanuts, you can have basil. Okay, vitamin K is the last one. This is a very interesting one. It was found over 50 years ago by Henrik Dam in Denmark. And he found it's an anti-hemorrhagic factor, so he called it vitamin K. K was for coagulation vitamin. That's how the German language writes a C as a K. And it's metabolized just like the other fat-soluble vitamins. You know, it goes in the intestine, goes in the mycelials, up to the lymphatic system, to the liver. The source, dietary, and then you also have bacteria that make vitamin K for you also. It activates coagulation factors, it's oxidized, releases energy, not just in blood products, but also in bone. So it is important in the growth of bone. However, because it also is an anticoagulation factor, it should be used in caution with people who are taking anticoagulants, because it will interfere with their warfarin. So they should get it from their dietary sources. And the other thing that's interesting about vitamin K, you know, if you don't have enough, you bruise, etc. Rare in adults. Babies aren't born with it, so they need to have they need to have a shot of it. They're deficient to 20% of adult levels for the reasons that their liver's immature, low vitamin K in breast milk. They don't have any bacteria to make it in their GI tract, and it's not crossed through by the placenta. So what we do for newborns is they get a shot of aquamaphytin when they're born, which is vitamin K. And for down the road, now here's herbal supplements, ginkgo biloba. Do you want to? I want to do about 3 more slides on how to measure ginkgos, but how to measure herbal supplements, but we won't go into them because I'm already out of time. That there's 20% of the U.S. population use herbal supplements, and here's the percentage of those that do, the top ones. Ginkgo, the reason I picked that one is it's one of the oldest. It has one of the most research done with it. The ginkgo tree is the world's oldest living tree. If you look at the leaf of a ginkgo, it's between a pine tree and a leafy tree. You can see the little spines like pine. That's why it's so old. Traditional Chinese physicians used it over 1,000 years ago. Other herbal supplements, you know, the Egyptians used sal pimento. Hippocrates recommended St. John's wort. In China, the Yellow Emperor used a lot of different remedies. European immigrants brought herbs to America. They combined them with the natural herbs. And in 1820, the first edition of the U.S. Pharmacopoeia was published with all the herbs. Here's some plants, some common drugs that we all use that came from herbs. And the reason I'm saying this is because when I tell you I don't want you to use herbs, I don't want you to feel that I'm being prejudiced or that I wouldn't use herbs at all. It's just they're so valuable, but as you'll find out, there's no regulation on them. There's no safety on it. So like 30% of the ginkgo that was sold a couple of years ago was cut with lead. You know, that's very dangerous. So you get atropine, codeine, colchicine. So what are the concerns with herbals? Well, we think nature is benevolent, that it's and healing, and that it's natural without artifice. It wouldn't be out to hurt you, would it? But we can't find a straightforward cure for when we go to the doctor and we have this backache and it's, you know, he can't give us any reason to get rid of it. Nothing works. He can't even tell us what it's due to. We have a stomach pain. We don't know what it's due to. Can't seem to find out. These are the reasons people take herbs. But the makers of dietary supplements are not required to prove efficacy. They don't have to prove it works. They don't have to prove quality. And they're not obligated to report any harmful effects. So if you remember the Ma Wang, the ephedra scare, you know, that came out a lot later than it should have because no one reported that these young athletes were dying after taking Ma Wang. So what is a dietary supplement? It is a product containing one or more of the following: a vitamin, mineral, amino acid, herb, other biologic, concentrate, a metabolite, a constituent, or an extract. They try to make it as broad as possible. And this came out in the Dietary Supplement Health and Education Act. And they say the label must state We could say it all together if you want. This product is not intended to diagnose, treat, cure, or prevent any disease. But it can make all the health claims it wants to. It can promote prostate health. It can support the circulatory system. I don't know, does it hold up a pole and support the circulatory system? Is that how it works? Yeah. And ginkgo biloba, just really briefly so that we have some question and answer time. It was supposed to improve memory, help Alzheimer's, decrease intermittent claudication. I even gave it to my dad a couple of years ago. He told me it must help because he remembered to take it. But the big study showed that it didn't work. There was really, it didn't improve at all. On all the well-rounded studies, it did not improve. Now, there's lots of different substances in ginkgo biloba, so maybe we're just not checking the right substance yet. So overall, it doesn't seem to work with intermittent claudication, causes side effects. Some data says it might also increase bleeding risk. So again, you have to be careful if you are on warfarin, because if you take ginkgo, you even have a higher chance of bleeding. The fresh seeds are toxic. Roasted seeds can be dangerous. So life's a journey. Let's enjoy the trip. Thank you.